Hi everyone, and welcome to Tommy Talks Med. I'm Dr. Ifelayo, and today we're going to be talking about different types of vaginal discharge and what that means. Now, many of these diseases have a common name and a medical name, and I'm going to use both so you get a hang of what I'm talking about. The first one is bacterial vaginosis, also known as BV. Now, this usually has a thin, grayish discharge that can also be green. It's usually accompanied by a fishy smell. If you've ever heard somebody talk about that odor down there, it's very important to know that it might be bacterial vaginosis. Now, this is not a sexually transmitted disease per se, in that it's not necessarily one person giving it to the other, but it is associated with people who are sexually active or people that douche. The reason being, bacterial vaginosis is essentially an imbalance of the bacteria that normally live in the vaginal area. And so some are overgrown while some are deficient, and essentially that's what creates this odor and the discharge as well. Now, these douching techniques that claim to restore your pH and all of that may actually be putting you at risk for increased bacterial vaginosis. So that's something to be mindful of. And also, this can be treated with antibiotics that are prescribed by your doctor. So if you have this issue, definitely visit your OBGYN so she can test you or he can test you and treat you accordingly. The next one that we want to talk about is vaginal candidiasis. This is the common yeast infection. This is usually a thick white cottage cheese discharge that is accompanied by vaginal itching, sometimes burning with urination or after intercourse, and is also treated by antifungal medications that you can buy over the counter or you can be prescribed to by your doctor. The next one is trichomoniasis. Now that's a mouthful. It's also known as trich, and this is a yellow-green foamy discharge or frothy discharge. This is a sexually transmitted disease, and it is accompanied by a vaginal odor, itching, and burning as well. Sometimes you can also see spotting in between periods when this is getting severe. It is something that needs to be tested for and treated with a doctor's prescription. So please, 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 if you see any type of discharge resembling this, talk to your doctor about getting tested and treated. The big ones are gonorrhea and chlamydia. We all know about these, the clap and the clamp. This is a thick, greenish yellow discharge that looks like pus or infection, and it's very important to know that this is a sexually transmitted disease. If you did not know that before, I'm telling you now, it's a sexually transmitted infection. And it's something that you can also have, like the other one, burning with urination, spotting in between menses, or as it gets more progressive, severe abdominal pain. This is also treated with antibiotics. Now, gonorrhea can be treated with an injection, and chlamydia can be treated with pills. But these are STDs, like I said, and it's very, very important to get tested and treated for these also. Now, last but not least, I think it's important to know what normal discharge looks like. This is usually clear to egg whitish. It doesn't have a smell, but it can vary in thickness depending on your cycle and where you are in your cycle. In future videos, we'll talk about fertility and how this may even be a marker of when you're ovulating. I hope this is helpful, and the reason I took time to record this video is because if you are having any of these discharges, I highly encourage you to go get tested and treated, because some of these, especially the sexually transmitted infections, can progress and start to lead to scar tissue in the uterus and the fallopian tubes if they're not properly diagnosed and treated on time. And this can later impair fertility. So it's very important to not take these for granted. Don't sweep them under the rug. And yes, Christian monogamous couples can have sexually transmitted diseases. It is very important, regardless of who you are, what your relationship status is, that you get tested for any diseases or any abnormal discharge and get treated accordingly. Again, I hope that you are in good health as your soul prospers, and I will see you in the next video.